Hi, guys, and welcome to COSI Talks Live. It is day 3 of Limb Loss Awareness Month. So I'm going to give it a couple of seconds for let people jump on. I am running quite a bit late this evening. We had quite a few things going on in our household, and I'm going to go ahead and go live on Instagram. All right, so we're live on Instagram, live on YouTube, live on Facebook. Okay, so Limb Loss Awareness Month, all April, we are going to be going live every evening at 8:30 p.m. and I'm going to be answering one question. It's going to be really hard. For those of you who watch my show regularly, you know that I have a very hard time limiting my chatter. Okay, so for those of you who are perhaps watching this for the first time, welcome. My name is Cosi Belloso. I am a physical therapist in Tampa, Florida, and I've been a PT now for a little over 23 years. And my passion is working with the amputee and limb loss community. So for the month of April, which is Limb Loss Awareness Month, I will be going live every night. My typical show is done on Wednesday nights at 8:30 p.m. Eastern Time, and we do a much, much longer show. So tonight's key question was sent to me by one of my viewers on the text messaging service. And it was, is there anything that can be done for nerve pain? Hey there, Chuck, Helen, Scott, good to see you guys here. So the answer is yes. And a lot of it depends on what kind of nerve pain are we talking about? Where is it coming from and what is causing it? All of these questions are really important to determine the root cause of that nerve pain, okay? Not all nerve pain is created equal, and there are different solutions depending on what is causing the problem. Hey there, Earl, good to see you. So when it comes to nerve pain as it relates to amputees, one of the more common ones is the kind of nerve pain that causes phantom limb pain. Okay. And we're going to go a little more into that later on this month in terms of all the different things for phantom limb pain. Okay. One of the causes of phantom limb pain is something called a neuroma. Hey there, Jerry Ann. Okay. So let's backtrack it just a little bit. When a surgeon does an amputation, right, they'll cut through the soft tissue, they'll cut through the muscle, they'll cut through the bone, and then they take the nerve, they pull it out, they cut it, and then they push it back into the soft tissue. Okay. So the problem is when that nerve is healing, it's going to form a ball of scar tissue around the end. And we call that ball of scar tissue a neuroma. Okay. So if that neuroma is sitting on a motor nerve, there's usually not a problem. If that neuroma is sitting on a sensory nerve, fireworks. Fireworks can happen, especially if it's in a particular place in the residual limb where it's getting pushed on by the socket. Okay. Now, are there amputees walking around with neuromas and they don't even know it? Absolutely. The only time we really know there's a neuroma is when the person begins to complain of like nerve pain or severe phantom pain. Hey there, Glenn. I'm glad you can make it this evening. Okay. So when my patients come to me and they talk to me about the phantom pain, one of the things that pops into my head is, do they possibly have a neuroma? Okay. And again, it's a very nerve type pain. It's shooting, it's burning, it's very, very, very intense and very exquisite pain. Okay. So one of the ways that we can test to see if there's a neuroma is by palpation. So I might just push my thumbs into that area. And if the person is like, that's the pain, then we know we're on the right track. And then it can further be diagnosed through ultrasound, sometimes even through x-ray. It can show up depending on the size. Okay, so why does this happen? Well, basically, the whole purpose of a nerve is to innervate. It's either going to innervate a muscle or skin or something. It has to do something. So when you leave a nerve just flip-flopping around in the soft tissue like that after amputation, it's going to get itself into trouble. Okay. So enter this procedure called TMR, targeted muscle reinnervation. Okay. With targeted muscle reinnervation, the surgeon takes that neuroma, that nerve ending, takes off the scar tissue, and then basically plugs it into a particular point in another muscle. Okay. So in doing this, they're basically giving that nerve somewhere to go and someplace, something to do, as Dr. Dumanian would say. And Dr. Dumanian was the surgeon who pioneered, one of the two surgeons who pioneered this particular procedure. Okay, so you can imagine that little nerve ending goes into the muscle and it starts happily spreading around and growing its little nerve rootlets, and it's a happy camper. Okay, and there have been some significant improvements on nerve pain and phantom limb pain with targeted muscle reinnervation. Okay, a sister surgery, I call it a sister surgery, is called RPNI, regenerative peripheral nerve interface, RPNI. Okay. And it's the same kind of concept where the surgeon will take the nerve ending. They won't plug it into a muscle, but they'll wrap a muscle graft around that nerve ending. So again, you're covering that nerve ending and you're giving that nerve something to do. And that's going to make it a happy nerve. Okay. So those two procedures, targeted muscle reinnervation and RPNI, are very, very successful in helping to treat nerve pain. Okay. Now, there are other types of nerve pain that can be related to issues in the back, issues in the spine, things like that. And there are other procedures that can help with that, other strategies that can help with that. Probably the most common nerve pain that I will see related to amputee care is the kind that inflicts and causes phantom limb pain. And again, very successful treatment can be TMR or RPNI. All right, guys, I'm going to go ahead and post a link to one of my videos where I go more into depth about TMR and RPNI, and I'm interviewing the surgeon, Dr. Dumanian, who pioneered that surgery, and he does a wonderful job of answering questions on that particular episode. So I will put that link as soon as I close this show down. So guys, don't be shy. Send me your questions. You can text me, text COSI Talks, all caps, one word, to this number that I am going to post. And you can text me your questions directly. All right, guys, if you liked what you saw tonight, if you're not already doing so, please consider following me on Instagram, on Facebook, and subscribing to my YouTube channel. I've got lots and lots and lots and lots more videos there as well. Okay, so as we can see, we'll stay tuned tomorrow for day 4 of Limb Loss Awareness Month. Send me your questions. Please share this video out, and I will see you guys tomorrow. Same bat time, same bat